is Dr. Langlaw. I want to thank everybody for tuning in and coming on this little drive with me through the countryside here. Certainly, finally, the sun's coming out, the weather's warming up, which is a beautiful thing to happen here in the Mid-Atlantic and Northeast, because that hasn't happened for quite a while, and hopefully we're turning the corner to spring here as we move right along. But we are still in the month of February, so winters can still have a little bit of a grasp, I suppose. But one other thing also to remember about the month of February is that it is Heart Health Awareness Month, and of course that is something that we stress very much for ourselves, making sure that our hearts stay nice and happy and healthy, and we stay nice and happy and healthy. But I think what a lot of people don't necessarily also realize is that it can be something that is very important for everybody to be aware of, that there can be heart conditions and situations that can affect our pets as well. And that is, you know, kind of what we're going to talk about on this little drive as we kind of go through here. And so we're going to try to talk about everything that involves heart health with your pets and things that you can be aware of, what your veterinarian can help you with, and signs you may want to watch out for, and if your pet may all of a sudden be looking to be suffering from some heart condition. So first thing I wanted to talk about was basically just to kind of clear up a little bit of a misconception that some people have, in that normally pets do not develop the same type of heart conditions that we do, or at least the ones that we're all aware of. So the biggest thing that we worry about, obviously, with humans a lot of times is clogged arteries, high cholesterol, high fat deposit builds up in the arteries of the heart, and that can of course lead to heart attacks and strokes and other issues. We normally do not see that type of heart issue in a dog or a cat, and the real reason for that is they just don't tend to live long enough. Usually, unless there's some sort of genetic issue that predisposes a person to developing these conditions very early on, this can take decades to build up in a lot of cases and then cause problems. And obviously our dogs and cats, unfortunately, they just don't live long enough you know, to have that buildup actually cause an effect, which, you know, is a good thing from the fact it doesn't affect their heart. Of course, bad things, everybody says, because we can't enjoy them with us, you know, longer than, you know, maybe 10 or 12 years on average, maybe a little bit longer for cats. So when we're talking about heart disease and heart issues in dogs and cats, we're usually talking more about a structural abnormality in the heart itself. And usually in dogs, that involves valve issues. So there's multiple valves in the heart that make sure the blood stays in the proper chamber as it's being pumped through. And in cats, we usually talk about a thickening of the heart muscle itself. And a lot of people would say, well, now wait a minute, you know, heart thickens, more muscle, more pumping ability, that would actually be really good, wouldn't it? Not necessarily, because unfortunately, the more muscle mass that is kind of created in these situations in the heart, the less open space there is per se in a chamber to fill with blood to then be pumped through. So while it may sound like having more muscle is a good thing, it's actually really not in a lot of these cases. And like I said, we do see this type of issue more so with cats than we do with dogs. So, you know, keep all of that stuff in mind as we go through this. Now, the other thing to remember with it is that there are certain dogs out there, breeds that may be predisposed to certain type of heart issues. I will say that a lot of the smaller breed dogs usually are prone to potentially developing some what we call valvular insufficiency or some mitral valve issues as they go on in their life. And, you know, it's something your veterinarian can talk to you about. If you're looking at potentially wanting to get a specific type of dog or cat, you know, you certainly can talk to your vet to see if there are any, you know, potential conditions in that breed, not just heart related, but any medical condition. And on the bigger dog side, it's sometimes valvular as well, but it can be involving different aspects of the valve and different chambers. And I'm not going to go into a whole bunch of stuff with it. Again, it's something you can talk to your vet about or research a little bit more if you would like to on your own. Certain dogs, such as boxers, sometimes can be prone to actually electrical rhythm abnormalities in their heart. So it's not a structural problem, but an electrical problem in their heart. It's something called boxer cardiomyopathy that some of them can suffer from. Dobermans sometimes can be prone to what we call dilated cardiomyopathy, where their heart muscle actually thins out and cannot pump as effectively as it normally would because of the conditions that are there, you know, preventing that. So these are all things to kind of keep in mind when we think about heart disease in dogs and cats. Now, of course, one of the things that we also stress to pet owners a lot of times is that more often than not, these problems are going to be there before your pet start showing any kind of symptoms or signs of an issue from them. And that is why, as we have said from the start, it is very important to make sure your pets get yearly exams, even if they're not due for any type of vaccines, is what the vet is trying to say, because we can do a whole bunch of things to hopefully find some of these problems. And we wear and use a wonderful little piece of equipment here, our trusty little stethoscopes, to go ahead and listen to your pet's heart and lungs at every visit to make sure there's no changes. And the two main things when it comes to listening to their heart that we're checking for is their rate and rhythm, so making sure that their heart isn't beating too fast or too slow, and that it's kind of at a very nice and normal steady rhythm. And we're also listening for any kind of abnormal sounds that may be occurring in listening to the heart itself. So normally, as everybody has heard, the heart normally makes a lub-dub, 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 lub-dub sound, and that sound that you're hearing is actually the different types of valves in the heart closing when they should, to make sure that blood stays in the right chamber of the heart before being pushed on to the next part, or to make sure the blood doesn't backflow into a chamber of the heart, causing problems, and we'll talk about that in a second. If there's an abnormal sound in the heart, we normally refer to that as a heart murmur. And so if you hear your vet say, oh, I'm hearing a little bit of a murmur or a loud murmur in your pet, instead of the normal lub-dub, 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 you're hearing more of a duh, 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 duh. Or sometimes if it's really severe, you don't even hear a dub in there. It's just and of course, you can Google sounds of heart murmurs. It'll be a hell of a lot better than what I just came up with, but that's the general idea. And murmurs are graded on a scale of 1 to 6 based on their severity. So you may hear your vet say, oh, he's got a 1 to 2 out of 6 murmur, or it's a solid 3 murmur. And really, the scale works, 6 being the worst type of murmur you can have, or the loudest, 1 being the best or the quietest type of murmur. Now, depending on what's causing the murmur, if it's a problem with a valve, if the dog or cat was potentially born with a hole somewhere in their heart that didn't close right, so you have blood shunting where it shouldn't, if there's an extra vessel there sometimes that didn't close like it was supposed to, causing an abnormal sound, the sounds are going to be different, and we may not hear them at every location when we listen to the heart, but only if we're over a certain area or over a certain valve. So keep that in mind. Some younger puppies and kittens get what we call physiologic murmurs. So it's just something that we hear a little bit of an abnormal sound. It's usually a grade 1 out of 6 murmur, but it goes away as they grow. So it's just kind of a growing pains type of thing. It's just something we monitor. Now, if your pet is found to have a murmur and is not showing any major signs or symptoms or secondary issues to it, and we'll talk about that in a second, your vet may not do anything right away. What they might say is just say, okay, we've noticed this. I'm not hearing any other problems. I'm not seeing any other issues kind of, with your pet right now. Let's see him back in a month. Let's listen again and see if it's still there, see if it's changed at all. And if it's still there or has changed, then we'll talk about potentially the next diagnostic steps that we would go through. And again, we can, of course, talk about that in a second as well. The other thing that we kind of listen for is abnormalities in their rhythm, or what's called arrhythmias. So normally the heart should have a fairly regular beat to it, but if we hear things that all of a sudden where the heart speeds up for a second and then slows back down, or there's what we call a drop beat, where heart's beating along very nice and even, and then there's a break for 3, 4, 5 seconds, and then the heart picks up again. All of those can be signs of electrical disturbances in the heart, same as we get, that can potentially be a problem or not be a problem. We did talk about, again, boxer cardiomyopathy being something to be, concerned about. So normally what your vet will do at that point is recommend that an ECG or an electrocardiogram be done, and this just checks the electrical rhythm through the heart and see if it's something that, truly needs to be concerned about, or if it's something that we just note and, watch again. So if a vet does notice anything with their stethoscope with it, normally what we're going to do is we're going to note it. If it's something that seems pretty serious, we're going to talk to you about doing further diagnostics, which we're going to talk about in a second, and potentially seeing them back for that, or potentially a referral to a cardiologist for more in-depth testing. We'll talk about that in a second as well. And or if it doesn't seem too severe, we might say, let's just see them back in a couple of months, listen, and make sure it hasn't gotten any better, or if it's gotten worse or gone away, that's a great thing, and just kind of go from there. So not every murmur is treated the same way, not every condition is treated the same way, so kind of keep all that stuff stuff in mind when you're talking to your vet about it. What your vet will tell you about, though, is start to look for potential signs, or you can be aware of this, if you notice your pet showing any of these signs, maybe something's going on with their heart, just to be aware of. And, if your vet tells you to watch for these, it's important to note them. If you just happen to notice that your pet's showing any of these signs, it may be a sign that you want to call your vet, make an appointment, and, have them checked out just to make sure everything's okay. And unfortunately, there's not a lot of real great specific signs when it comes to heart disease in dogs and cats. Some of them can be very non-specific, which is why it's important, anything you may notice, you tell your vet about, so this way we can research things a little bit further. But some of the things you definitely want to watch for a little bit would be maybe being a little more lethargic, not being as active, not being as interested in being as active. Maybe you're used to going on, hour-long walks, and all of a sudden, after half an hour, your dog seems really tired, doesn't seem to really want to be able to go on. Maybe your cat doesn't play quite as much as they used to. Those would be signs of, there might be something going on where they're just tiring more easily. Sometimes we notice something is a little bit out of the ordinary is not eating. Their appetite falling off a little bit just because they're not feeling great, because they feel that something's wrong. That's something else to keep an eye on. We may also see sometimes signs of coughing, and the coughing can be consistent, where they're coughing all the time. It can be intermittent. It can be only when they start really exercising more, or again when they're doing more strenuous activity. So a cough can be a sign of a heart issue. It can also sometimes just be a sign of another respiratory or lung issue. But your veterinarian can help you determine all of that stuff. And then the final thing could be potentially an increased respiratory rate. So you notice that especially when they're resting or sleeping, they seem to be breathing at a quicker rate than normal. And that's something you have to watch kind of over time a little bit, or even when they're trying to get comfortable for bed, they just can't seem to settle. They seem a little bit more anxious or on edge. They don't sleep quite as long through the night as they normally did. They're getting up, they're pacing a little bit. All of those signs may be signs that there's something going on with their heart. It can also be signs of other things. So it's very important to note all this stuff and tell your veterinarian, or make an appointment with your veterinarian to have them checked out when these things do occur. So we talked a little bit again, if your vet does discover something with the heart, well, what's kind of the next step? Normally, 3 things are going to be suggested. The first of which is chest x-rays or radiographs. And the reason we're doing this is we want to see if there's any evidence of enlargement of your pet's heart, which we can sometimes see on radiograph. That can be a sign that there's a problem somewhere, or the heart's not functioning as well. We also want to be able to check their lungs, because if the heart is not able to pump as it normally does, you do have blood that can't go everywhere that it normally goes as quickly or as often as it should. And one of the places blood and fluid can back up a little bit is into their chest. So when that happens, we can see evidence of that. It's called pulmonary edema. Sometimes people call it water on the lungs, and we can see evidence of that on x-ray. And that can be a sign that your pet is in what we consider a state of congestive heart failure or congestive heart disease, depending on how you read it, described. And there are things that we can do for that, and we'll talk about that in a second, but that's a very important thing. So if your vet wants to take x-rays, that's why. We want to evaluate your animal's heart size. We also want to evaluate the lung function of the animal and see if we need to intervene to give some medication. The next thing we talked about a little bit too might be an echocardiogram or an electrocardiogram, which again checks the electrical activity through the heart. And if we pick up an abnormal type of rhythm, an arrhythmia of some kind, again, there might be something we can do to help correct that. You may even, if your pet is suffering, let's say, fainting episodes or something like that, or we're not hearing anything when you bring them into the vet's office, but from what you're describing, it does sound like there might be a rhythm disturbance or something. They actually do make what they call Holter monitors for dogs and cats. More so for dogs. Cats, it's a little bit harder to get them to keep it on, obviously. But just like it works in us, it's a 24-hour monitor, and they'll look to pick up any kind of weird rhythms that may happen only for a short period of time, and then we can help, diagnose off of that as well. The final thing that we may look at is, or recommend, is something called an echocardiogram, and this is a sonogram or an ultrasound of the heart, and it usually is done by specialists in veterinary medicine, veterinary cardiologists, and that is the only way to get a really good structural look at the heart. So like as I was saying before, when we hear these murmurs going on, We don't really know what's causing it. We can guess, but we don't really know for sure. And the only way we know for sure is by doing this echocardiogram, because we can then assess the valve structure of the heart. Is there blood leaking through chambers? Is there a thickening of the heart muscle, let's say in cats or even dogs? Is there a thinning of the heart muscle that's causing a problem? An echocardiogram can measure all of these values, and then we have a pretty good definitive diagnosis as to what's going on. And then the cardiologist will either talk to you directly, or they will talk with your veterinarian about formulating a treatment plan for your pet and what the next steps would be. Sometimes there's other blood tests that are done on rare occasions looking for certain different things, but in most cases, if you have a heart problem with your pet, those are going to be the three kind of diagnostic tools that we look at to kind of assess what the issue is, and also to monitor therapy. So we may repeat the echocardiogram, we may repeat chest radiographs every so often, just to keep an idea on how things are going, and if we need to do any kind of change in medication or anything like that. And the last thing, again, so you've done all this, you've now had the problem diagnosed, and it's like, okay, what can we do now? I mean, I know that they've made tons of strides in human medicine about all these different, treatments and surgeries and weird procedures and coil things and all this other stuff that I see done on all those medical shows. Can you do all that stuff for pets? And the short answer is not in most cases. They have just started really looking at some valve replacement surgeries for dogs. They are done very sparingly, and it's only a handful of cardiac surgeons that are working on this and trying to train other surgeons on how to do it. And usually it's only recommended for the most severe of cases where the dog is in constant congestive heart failure, that medication is not helping, and things are decompensating. So there's a lot of factors that go into any heart surgical correction. They are being done, but it's something that is not done super often, and it's a very case-by-case basis. Now, if your pet is in a form of kind of congestive heart failure or congestive heart disease, as we talked about, usually the first thing we're going to try to do is decrease the fluid load on the lungs. The most important thing is trying to get it so that the lungs are not battling with that fluid to take in oxygen, and it'll make your pet feel a lot better. So usually what we'll start them on is a diuretic, most commonly called Lasix. A lot of people call it the water pill, or water pill that somebody would take, if they were having heart issues and congestive heart failure. And so this will remove some of the fluid load working through the kidney. Your pets will pee a lot more, so just be aware of that with it. But what that does is reduces the fluid volume a little bit. So again, that fluid then is kind of sucked up out of the lungs by the vessels, and your pet will be able to breathe a lot easier. Usually we have to kind of tinker with that dose sometimes, so we're not getting a full effect necessarily right away. It may be given as an injection by your vet and then followed up with pills at home. Your pet may need to be hospitalized for a couple of days if they need really severe monitoring and in-depth monitoring and treatment through injections of Lasix. So all of those things, just keep in mind. Again, every case is a little bit different and case specific. And then we will look at potentially doing some medication to ease the workload on the heart. So we can give things like beta blockers. We can give things like ACE inhibitors. And these are all things that are used in the human world, designed to kind of reduce the workload of the heart a little bit, reduce the fluid load on the heart, to make it easier for as long as we possibly can for the heart to pump more normally. And every case, as I said, is a little bit different, and ideally we would want that echocardiogram done if it's a structural defect, and definitely the electrocardiogram done if it's an arrhythmia, to make sure that we're choosing, and your vet is choosing, the right medication for the condition your dog or cat has. We really don't want to guess in these situations. There are some, again, more broad spectrum, if you can use the term, heart medications that are fairly safe to use in most cases, but you definitely want to talk to your vet or your veterinary cardiologist about what is best for your specific pet, because we may only want to start with one drug if we're not seeing congestive heart signs at that point, but we know that there's an issue with the heart, and then only add other drugs in if your pet starts to show more severe symptoms. We don't want to start them on every single drug under the sun right away, because there is a point where these drugs will no longer have the same type of effect that they've had before. And that is something to keep in mind, because then we're kind of stuck a little bit as to what medications we can use. So these are all things that you can, obviously discuss with your vet. If it's a arrhythmia issue, those drugs to try to help control that are different than drugs that you might be using for congestive heart failure due to a valvular problem. So these are all things you need to have a really in-depth conversation with your vet about, so you understand what is going on with your pet's heart at the time and why we're using the medication we're using. And the one thing I will stress right now to everybody: do not use any of your own or a family member's heart medication on your dog or cat if you suspect there's a problem, or if you happen to run out and it's like, oh well, my grandmother takes Lasix, I'm just going to give him one of her Lasix pills. It may not necessarily be exactly the same type of diuretic. It may not be the right dose. You can cause a lot of problems if you start trying to use human heart medications in animals, so do not do it. Final thing I'll touch on real quick is, of course, we try to cover all species here. Yes, larger animals can develop heart issues. There are certain heart issues that can happen in horses. Horses can be prone to certain arrhythmia conditions, and usually signs in horses, unfortunately, sometimes it's just collapse. When they're working, you don't see a sign before that, but sometimes you'll see them almost show some colic signs, being very agitated, anxious, sweating a lot, things that can mimic early colic signs, and it's actually due to an arrhythmia going on, because they feel really weird. Anybody that's probably had an arrhythmia knows that it feels very odd in your chest, and so horses demonstrate that by showing those anxiety and anxious signs. So kind of keep that in mind if you do happen to have a horse, and of course you should have your horses checked by your vet at least every year as well, and they'll take a good listen to the heart to make sure that everything is good there. So with all that kind of brings us back to the beginning and the favorite part of every episode of Driving with Doc, and I'm sure what some people fast forward through all the other stuff for, just so they don't have to hear me talk as much. That's right, it is time for Doc's 5 most important takeaways from this episode of Driving with Doc. And so let's get right to it. Number 1, remember, heart disease in dogs and cats is different from heart disease in people in most cases. So you're going to have different problems in dogs and cats that are not similar to the types of problems that people get with clogged arteries and heart attacks and all of those things. Number 2, remember, your vet can detect things with their stethoscope long before usually there is a problem where they're showing symptoms of what's going on with their heart. So it's very important to have their hearts checked at least yearly, and more so if they actually do have a problem with their heart, and your vet will set up a schedule for that. Number 3, make sure that you know the potential signs of heart disease or heart problems in your pet, and we went over those before. If you see any of those symptoms, please let your veterinarian know, and get your pet seen as soon as possible, because the sooner that we can find something, the sooner we can pick up on something, the more easy it is for us to diagnose it, and usually the better treatment outcomes we do have for those types of things. Number 4, remember that if we do find something, that usually we are going to recommend having more in-depth diagnostics done in the form of chest x-rays, an electrocardiogram to check the electrical rhythm, and an echocardiogram to check the structure of the heart and make sure that everything looks okay, or defining the exact problem that's on there, and that will determine how we go forward in our plans. And number 5, remember, we do have treatment modalities available for most heart conditions in animals. Certain conditions we cannot reverse, and I touched on that. We may not be able to cure them, but what we can do is provide months and sometimes years of very quality life for your pet just by working on medications. And your veterinarian needs to talk to you about individual things that are needed for your particular animal. Every case is different. You do not want to go using any kind of medication that you may have heard of for your pet's heart health or to fix a heart problem in your pet without talking to your veterinarian. So remember, there are treatments out there. It takes a little bit of diagnosing to figure out exactly what's going on so that we can decide what medication is best for your pet's heart health. So, hope that kind of gave a broad overview, at least a little bit, of heart disease in dogs and cats. As always, if you have any questions about anything that you think I might be able to answer for you, you are free to drop us a line at drivingwithdoc@gmail.com. Again, drivingwithdoc@gmail.com. If you have topics or suggestions for any future episodes of things you might want talked about with your pets, we'll be happy to research them for you and hopefully bring them back right here and talk to them, or talk about them, I should say, as we go on a nice drive. And of course, you want to send hate mail, go ahead. You want to send fan mail, go ahead. I will read every single one that comes through and respond accordingly. So hope everybody did find this a little bit informative. Again, if you do have any questions about the health and well-being of your pet, there is only one place that you need to turn to, and that is making an appointment to talk with your local and trusted veterinarian. So until next time, hope everybody enjoys the start of the warmer weather, hopefully, and the end of the snow, and moving along into the spring and summer months. And we will see you next time as we go driving with Doc.